name is Nick, and today I'd like to present on some of the work that I've done with Professor Klotz in the lab this semester, titled Words Matter, the Impact of Language in Transgender Healthcare. So before I get started, I would like to define some of the broad terms that I'll be using throughout this presentation. First, starting with cisgender, which is an adjective relating to a person whose gender identity corresponds with the sex registered for them at birth, or not transgender. For example, a cisgender woman would be a woman who is assigned female at birth. Transgender, on the other hand, is an adjective relating to a person whose gender identity does not correspond with the sex registered for them at birth. So a transgender woman would be a woman who is not assigned female at birth. Non-binary is a gender identity that is not identifying as male or female, so having a gender identity that does not conform to the traditional binary notion of gender, according to which all individuals are either exclusively male or female. And finally, gender dysphoria is a diagnosis that is the feeling of distress that can happen when a person's gender identity does not correspond from their sex assigned at birth. So how do these kinds of identities relate to healthcare? We understand that healthcare is designed to be meant for everyone, but unfortunately a lot of transgender patients do experience healthcare a lot differently than cisgender people do. And this goes beyond looking for specific gender affirming care. This goes simply to doctors interacting with their patients in things like primary care. There are a lot of structural and financial barriers, and unfortunately the research has shown transgender patients experience roughly 19% of transgender individuals do not have health care, and about 25% of transgender individuals in the past have reported being denied healthcare services from providers. So this can lead to a lot of problems for transgender patients down the line that cisgender people don't experience. And this is shown in certain things like transgender patients not getting preventative screenings that they need. So for example, transgender men are much less likely compared to their cisgender female counterparts to receive annual or 3-year pap smears compared to females. So roughly 68% of transgender men receive routine pap smears compared to 87% of cisgender females, even though they are either at equal risk or at higher risk for cervical cancer, which can lead to cancers going undetected for longer.
Hey Nick, sorry to interrupt, you didn't admit.
Oh, yes. Along with structural and financial barriers to healthcare, there are also interpersonal and psychological barriers that transgender patients experience as well. According to the 2015 National U.S. Transgender Survey, 23% of transgender individuals reported avoiding seeking the care that they needed due to fear of being discriminated against. And 1 out of 3 of those participants reported that they had had a negative experience with a healthcare provider in the past year. And some of those negative experiences can include things like misgendering, using the wrong pronouns for a patient, or dead naming using their incorrect name. And prior research has shown that misgendering can lead to psychological distress in transgender individuals, as well as increasing the risk for mental health conditions such as depression, anxiety, and suicidality. Prior research has shown that approximately 81% of transgender individuals have experienced suicidal ideation, and 42% of transgender individuals have actually attempted suicide. And having a healthcare system that is not affirming and not accessible will only further contribute to this being a problem. So this is what led me to my research question. I wanted to know, what can providers specifically do to better affirm their transgender patients? And I wanted to focus specifically on language, and specifically in the St. Louis region. So that led me to my research question: how does the use of language by providers in the medical field affect the quality of transgender patient care in St. Louis? So my method, I used a mixed method approach, utilizing both a Qualtrics survey for quantitative analysis and one-on-one interviews and focus groups for qualitative analysis. So I separated into 2 phases, phase 1 being my Qualtrics survey, and phase 2 being my qualitative analysis. So I'm currently completed with phase 1, my survey. So this online survey was completed through Qualtrics. It was titled Words Matter, the Impact of Language in Transgender Healthcare. And our participants were both recruited over social media and through flyers dispersed across Webster University campus. And our participants did have a chance to win one of 10 $10 Visa gift cards. So we had 17 participants. The age range was between 18 and 65, although a majority of our participants were age 18 to 24, about 82%, likely because of how we recruited over social media on a college campus. And one thing I would like to mention, in our survey, we did use a text box instead of multiple choice for both gender identity and sexuality. That way we could get the most accurate description of their identities. So we had a wide variety of self-described gender identities, which included both binary transgender identities, so trans male, trans female, and non-binary We also had a wide variety of self-described sexualities, including lesbian, gay, bisexual, pansexual, demisexual, queer, and questioning. A majority of our participants were white, but we did have one mix and a Pacific Islander participant. And all of our participants are currently living in the St. Louis area or just outside, but a majority were living currently in Western Rose. So the results, we asked our participants to rate their level of agreement on a variety of different questions regarding different medical providers. And we categorized these medical providers into two main categories. First, those providers who are related to gender-affirming care and providers who are unrelated to gender-affirming care, and then comparing the trends between different medical providers. So the statements that we asked them to rate, we asked them different questions about patient comfort and also about the provider's use of language. So we did this on a 5-point Likert type scale, where 1 indicated that the patient strongly disagreed with the statement, a 3 indicated they neither agreed or disagreed, and a 5 indicated they strongly agreed with the statement. So on this graphic here, this is displaying a primary care provider in the context of they are providing gender-affirming care. And I'd like to focus first on 2 main points on this graphic here. 1, whether or not the provider is using affirming medical terms, and whether or not the patient is preferring that the provider asks them what terminology to use in the context of gendered body language. So we can see for a primary care provider that is involved in gender-affirming care, patients generally agree that they are using medical terminology that is affirming to their gender identity. And subsequently, we can see that there's a lower preference for whether or not they would like to be asked about terminology to use. I'd also like to focus on these next 2 points, whether or not the provider is knowledgeable about transgender health care. And these patients indicated that primary care providers were somewhat knowledgeable about transgender health care with a score of 3. However, significantly, they are very comfortable with these providers who are primary care and giving gender-affirming care, giving them a score of 4.6, which is wonderful to see, especially given the current political climate. We also were interested in looking at psychiatry, given the higher risk of mental health disorders for transgender patients. Similarly, we noticed that psychiatrists are okay at using medical terms, giving a score of 3.8, and also there's a lower preference for whether or not patients are wanting to be asked about terminology. However, psychiatrists appear less knowledgeable about transgender health care with a score of 2.8 compared to 3 for primary care providers, and they are less comfortable discussing transition-related goals without fear of judgment. And finally, we did ask about emergency room providers who are unrelated to gender-affirming care. And unfortunately, we saw that they are much less knowledgeable about transgender health care with a score of 2, indicating that these patients disagree with that statement. And they're also much less comfortable discussing health concerns with them without fear of judgment. And emergency room providers are not using affirming medical terms as much, and therefore, patients have a higher preference for whether or not they'd like to be asked about terminology. We also understand that there's a lot more to transgender patient comfort than just what happens inside medical offices and in conversations with doctors. So we did ask certain questions about the current political climate and how these patients feel about where their care is going to go. Unfortunately, a lot of our participants did indicate that they feared losing access to gender-affirming health care, and they were uncertain whether or not providers would be able to continue to provide the care that they need. And unfortunately, for those living in the St. Louis area, some of them did indicate that they might move due to fear out of losing their health care. So overall, we found that there are both interpersonal and systemic factors that influence transgender experiences in healthcare environments. We saw that there was an increase for preference for asking about preferred terminology when providers are not using affirming language, like for the emergency medicine providers. And we saw that the use of affirming language increases as patient comfort increases and as provider knowledge increases. So therefore, it is especially important for providers that are not actively involved in gender-affirming care to ensure that they're using gender-affirming language, whether that be asking the patient specifically about what terminology they prefer. Future directions for this study, we will begin phase 2, where we'll be asking or conducting one-on-one interviews and focus groups with these patients to follow up on the results of this study. So we're hoping to gain better experiences from transgender patients, asking things like, what is a specific example of how a provider was affirming to you in the past, so that we can add on to these results from the study. A couple limitations to this study, a big one was it was a lot more difficult to gather survey participants due to the current political climate. We did end up getting a couple of emails from students asking, how is our data going to be used? So it was a big concern for some certain participants to actually share this information with us. Another limitation was we did use convenience sampling, so that could potentially cause biased data, which we did see we had a majority white Webster Grove residents with private health insurance. And finally, I would like to acknowledge the Glitter Lab and everyone who's supported us so far. I'd like to give a huge shout out to Professor Clint Johnson for his support, for allowing a biology major to try psychology for the first time. And then I just want to give a huge thank you to Webster University for allowing us to continue this kind of research. If anyone is interested in learning more about the Glitter Lab or the kind of research we do, I did attach this QR code here that you can scan. Does anyone have any questions?
Nick, can you take a couple questions and I'll get the next one set up, please?
Yes.
What made you choose, or did you choose to have participants that were specifically located in St. Louis? I know that that's a limitation, but were there any benefits? How did you make that
Right,
decision?
yeah, I wanted to focus specifically on the St. Louis area because a lot of different regions, especially like with the political climate, might have totally different responses depending on if we're asking in a kind of blue area versus like if we're asking like in Jefferson City or a totally different area, we might have totally different responses. So I wanted to look at St. Louis area in particular.
So, what was it like working in psychology?
Just definitely out of my comfort zone, but it was amazing.
Good.
So as someone who currently works in healthcare now, what are steps we could be taking to ensure transgender comfortability in a hospital setting?
In a hospital setting, definitely, even just asking